Welcome to Sciencera. In this video, we're going to discuss part 3 from Skeletal System. In today's video, we're going to focus on joints and developmental aspects of the skeleton. Learning objective for today's video is naming the three major structural categories of joints and compare the amount of movement allowed by each joint. Then in development aspect of the skeleton, we're going to describe major changes in skeletal development at fetal, infant, youth, and adult stages of life. Identify some of the causes of bone and joint problem throughout the lives. Introduction to joints. With one exception, the hyoid bone of the neck, every bone in the body forms a joint with at least one other bone. Joint are also known as articulation, are the site where two or more bone meet. They have two functions. They hold the bones together securely but also give the rigid skeleton mobility. Joints are classified in two ways, functionally or structurally. Functional classification focus on the amount of movement the joint allows. On this basis, there are synarthrosis or immovable joint, amphiarthrosis or slightly movable joint, and diarthrosis or freely movable joint. Immovable and slightly movable joints are restricted mainly to the axial skeleton where firm attachment and production of internal organ are prioritized. Freely movable joints predominate in the limb where mobility is important. Classification importance structurally. There are fibrous, cartilaginous, and synovial joint. These classifications are based on whether fibrous tissue, cartilage, or joint cavity separates the bony region at the joint. As a rule, fibrous joints are immovable and synovial joints are freely movable. You can see the types of cartilaginous, fibrous joint and the synovial joint. Cartilaginous joints include synchrondosis, symphysis. Fibrous joints include suture and synovial joints include the multi-axial joint or uniaxial joints. Another example for cartilaginous joint are symphysis or fibrous joints include syndesmosis and synovial joint includes biaxial joints. Let's look at each one separately. Fibrous joint. In the fibrous joint, bones are united by fibrous tissue. The best example of this type of joint are the sutures of skull. In the sutures, the irregular edges of the bone interlock and are bound tightly together by the connective tissue fibers, allowing no movement. Gumboses are peg-in-socket fibrous joints that are found where the teeth meet the facial bones. In another type of fibrous joint, syndesmosis, the connecting fibers are longer than those of the sutures, thus the joint has more give. The joints connecting the distal end of the tibia and fibula is a syndesmosis joints. Then we have cartilaginous joint. Cartilaginous joints come in two varieties which differ in the type of cartilage involved. Synchondroses are immovable or synarthrotic joints linked by hyaline cartilage. Examples include the epiphyseal plate of growing long bone and the joints between ribs 1 to 7 and sternum. Symphysis or are amphiarthrotic, slightly movable joints linked by the disc of fibrocartilages. Examples include the intervertebral disc of the spinal column and pubic symphysis of the pelvis. Synovial joint. Synovial joints are the joint in which the articulating bone ends are separated by the joint cavity containing synovial fluid. All joints of the limb are the synovial joints. All synovial joints have four distinguishing features: articular cartilage, articular capsule, joint cavity, reinforcing ligament. Articular cartilage. Articular or hyaline cartilage covers the end of the bone forming the joint. Articular capsule, the joint surfaces are enclosed by a sleeve or a layer of fibrous connective tissue, which is lined with the most synovial membrane. The reason these joints are called the synovial joint. Joint cavity, the articular capsule encloses a cavity called the joint cavity, which contains the lubricating synovial fluid secreted by the synovial membrane. Reinforcing ligament is the fibrous layer of a capsule, which is usually reinforced with the ligament. The table shows the different type of joints, structural class of the joint, their characteristics, type, and the mobility. Starting with the fibrous joint. Structural characteristics include bone ends or part united by the collagenous fibers. Types include sutures, short fibers, syndesmosis, longer fiber, gombosis, periodontal ligament. Mobility, sutures are immobile, syndesmosis are slightly mobile, sometimes immobile, and gombosis are also immobile. Cartilaginous class includes bone end united by the cartilage. Synchrondosis, haline cartilage or the symphysis fibrocartilage. Haline cartilage is immobile and fibrocartilage are slightly movable. In the end, we have synovial joint, bone ends or parts covered with the articular cartilage and enclosed within a articular capsule lined with synovial membrane. Types include plain, hinge or pivot, condylar joints, saddle, ball and socket. They are freely movable. Diatherosis, movement depend on the design of the joints. Next we have types of synovial joint depending on the shape. The first type is planar. Two flat or slightly curved articulating surface that slide against each other allowing a side to side and back and forth movement is a planar joint. For example, intercarpal joint, intertarsal joints and the vertebral facet. Next is hinge joint. Typically has convex part of one bone that sits inside the concave part of another and allows an uniaxial movement such as flexion and extension. Examples include elbow, ankle, and knee. Then we have pivot joints. One bone pivots around another to create a rotational movement around a single axis. Atlantoxial joint between C1 atlas and C2 axis of the spine and radioulnar joint between the radius and the ulnar allowing them to pronate and supinate the hand. Condylar joint, an ovoid convex part sits in the ellipsoidal cavity of the other bone, which permits the flexion or extension, abduction or adduction, and the circumduction. For example, radiocarpal joint of the wrist and metacarpophalangeal joints in the hand. Then we have saddle joint. Allows articulation through reciprocal reception as the bones have concave or convex surface that interlocks permit flexion, extension, abduction, adduction and the circumduction. For example, carpo-metacarpal joint of the thumb. In the last we have ball and socket joint. Spheroid structure ball sits in the socket of another bone. This allows the multi-axial movement and has greater shape range of movement. The depth of the socket and the fibrocartilaginous labrum are the limiting factors for the motion. Example include of the ball and socket joint are glenohumeral joint and acetabulofemoral or the hip joint. Structures associated with synovial joint. Associated with synovial joint include bursae, flattened fibrous sac, lined with synovial membrane, filled with synovial fluid, not actually part of the joint. Tendon sheet, elongated bursa that wraps around a tendon is called tendon sheet. Inflammatory and degenerative condition. Dislocation occur when bones are forced out of the alignment, usually accompanied by sprain, inflammation, and joint immobilization. caused by serious falls and are common sport injuries. Subluxation are the partial dislocation of a joint. Then we have bursitis, an inflammation of bursa, usually caused by a blow or friction. Symptoms are pain and swelling treated with anti-inflammatory drugs. Excessive fluid may be aspirated. Tendonitis, inflammation of tendon sheaths typically caused by the overuse. Symptoms and treatment are like bursitis. Arthritis. Symptoms of arthritis include pain, stiffness, and swelling of joint. Two types of arthritis, acute or chronic. Acute forms are caused by bacteria and are treated with antibiotics. Chronic forms include osteoarthritis, rheumatoid arthritis, and gouty arthritis. Rheumatoid arthritis are chronic inflammatory autoimmune disease of unknown cause with an insidious onset. Usually arises between the age of 40 to 50 but may occur at any age. Symptoms and signs include joint tenderness, anemia, osteoporosis, muscles atrophy, and the cardiovascular problems. The course of rheumatoid arthritis is marked with exacerbation and remissions. Rheumatoid arthritis begins with synovitis of the affected joint. Inflammatory chemicals are inappropriately released. Inflammatory blood cells migrate to the joint, causing swelling. Inflamed synovial membrane thickens into a penis. Penis erodes cartilages. Scar tissue forms, articulating bone and connect. The result, ankylosis, produce bent, deformed finger. Treatment include conservative therapy and progressive treatment. Conservative therapy includes aspirin, long-term use of antibiotics, and physical therapy. Progressive treatment include anti-inflammatory drug or immunosuppressant. The drug Enbrel, a biological response modifier, neutralizes the harmful properties of inflammatory chemicals. Then we have gouty arthritis. Deposition of uric acid crystals in the joint and soft tissues followed by an inflammation response. Typically, gouty arthritis affect the joints at the base of great toe. In untreated gouty arthritis, the bone end fuses and immobilize the joint. Treatment include colchicine, non-steroidal anti-inflammatory drugs, and glucocorticoids. The last one is osteoarthritis. Most common chronic arthritis, often called wear and tear arthritis, affect women more than men, more prevalent in aged, and is probably related to the normal aging process. Osteoarthritis reflect the years of abrasion and compression causing increased production of metalloproteinase enzyme that break down cartilage. As one age, cartilage is destroyed more quickly than it is replaced. The exposed bone end thickens, enlarge, form a bone spurs and restrict movement. Joint most affected are the cervical and lumbar spine, fingers, knuckles, knees, and hips. Treatment of osteoarthritis is slow and irreversible. Treatment include mild pain relievers along with moderate activity, magnetic therapy, glucosamine sulfate decreases pain and inflammation. Developmental aspect of the skeleton. Fontanelles, which allow brain growth and ease birth passage, are present in the skull at birth. Growth of the cranium after the birth is related to the brain growth. The increase in size of the facial skeleton follows tooth development and enlargement of the respiratory passageway. Long bone continues to grow in length until late adolescence. By the age of 10, the head and trunk are approximately same height as the lower limbs and change little thereafter. Fractures are the most common bone problem in elderly people. Osteoporosis, a condition of bone wasting that results mainly from hormone deficit or inactivity, is also common in older individuals. Bring us to the end of the skeletal system. Thank you for watching. If you like my video, don't forget to subscribe for more.